for our employees who might spend 40 or 50 hours a week here. We have a wide range of offerings. There's not a one size fits all. And so we have been fortunate enough to have the autonomy to try all kinds of things. We try to be very responsive to our team members. We take their feedback and then try to improve our programming.
Thank you.
Yeah.
Very robust. Matt, it looks like you joined us by way of phone. Can you hear me okay?
I can, thank you. Can you hear me?
We can hear you. Welcome. Thanks for joining us.
Oh, thank you.
I just want to make sure you caught the first question and give you an opportunity to respond. At Charlotte's Web, a new industry, new business. Can you tell us a little bit about the organization, what makes it unique, and what's working well to support employee health and well-being right now?
Yeah, absolutely. So Charlotte's Web is the first company, or the first corporation, if you will, to get into the CBD market. So as a CBD health and wellness company, the Stanley brothers, there are 7 of them who founded this company, and it all kind of was blown open and blew open the market when a family approached the Stanleys to help their little girl battling severe epilepsy. And what they found was by extracting the hemp plant, a very low THC, high CBD content plant, that as soon as they gave it to her, she was experiencing 300 seizures a day, and that dropped to 1 almost immediately. So that blew open the big Newsweek articles around what they had found, how it helped this little girl, and then kind of opened up the market from a marijuana, a medical marijuana part of the industry to now what we have is a separated hemp, industrial hemp industry. So that's really where our beginnings kind of came from, and how the CBD market opened up across the United States and in Canada. What we're doing for total health and wellness with our employees, and keep in mind there was no health and safety implemented 7 months ago. So I came aboard and really started to shape what the environmental health and safety and total wellness program looked like. And what we've done to date is we've instituted 26 safety programs that cover everything from the general industry, construction, and agriculture as a vertically integrated company. So that means we do our own farming, and we bring that to the table across to our companies and our customers. We've also instituted a Take 10 for Safety, which is every Monday morning we send out a safety flyer on a topic that our teams will discuss. We've onboarded a chemical hygiene officer and pollution prevention and waste coordinator that will organize the chemical safety and also really look at our wastes so that we're not just sending them out for an incineration, but also taking that internally and creating secondary raw materials and getting them back into the product stream. We've established 6 safety committees and at 6 of our locations. We've also adopted for health and wellness a program that's called the Thrive Pass, and the company funds that up to $300, where our employees can, get a gym membership or do something for themselves for their own personal wellness, like massage therapy, chiropractic care, etc. And we've also put in and sponsored a hiking club for the summer, which is our first attempt at getting really that level of engagement up, exploring, from top to bottom, the wellness of the person and also the safety and environment behind them.
How fun.
Oh yeah, it's been a real joy the last 7 months. An opportunity like this doesn't come along very often. Most often than not, you manage or continue to manage and improve a process. And in this process, we get to build it from the ground up.
That's great. And Matt, just to remind us, how many employees right now does Charlotte's Web have?
We're encroaching the 300 mark. So we've started very small. We're still under the 500 mark, of course, and we're starting to build and gain that momentum as the market for this and the demand has just exploded.
Really interesting. So talking about the modern world now, it sounds like all three of you represent organizations that aren't only diverse in the nature of work and the needs around total worker health, but you have multiple sites. You're promoting programs to very different types of work settings. You have office-based workers, you have physicians, you have people in the field, and so I'm wondering, what do you feel are right now the most important three things for every organization to be thinking about in today's modern workplace, given the complexities of what we're seeing change around the nature of work? And Katie, why don't I start with you this time?
So I would have to say we have 85% of our workforce is female. So work-life integration, flexible schedules for everybody, but being able to leave if you have a childcare issue, being able to stay home with your family if you need to. We know that having a very rigid schedule, which is hard because in our administrative offices, we like to have flexible schedules, but if you're in a 12-hour shift, it's a little different, but really trying to have a supportive environment where you're allowing your employees the flexibility to take care of their families, because we want to support our team members, not only them, but their families as well. So the flexible schedule is a big one. It supports our employees and their families, increases productivity and engagement, retention, and it allows people to save PTO. If you have to stay home because you're not feeling well, which in a hospital setting, they don't want you coming to work if you're sniffling. So if you can stay home and still be productive, then you can feel good about still saving your PTO to then go on vacation, which we also know is really a wellness activity. And then again, not a one-size-fits-all program, and really meeting employees where they're at. We have team members who really don't want to participate in wellness, and we have to get creative in having opportunities and resources and activities that they want to engage in. And then being in Colorado, we have people who are out there doing ultras and marathons, and they want to be able to participate in things too and feel challenged. So really trying to be creative and have something for everyone. And then again, really focusing on the environment, because I spend more time here than I do at my house these days. And it really, the fact that we have a healthy food and beverage environment, we have resilient activities, we have walking workstations. If you can't get away from your computer and take a walk, we have an on-site gym, really trying to provide a supportive environment so employees can feel that when they're on site.
Great examples. Christina, how about you?
Yeah, so I probably have a few duplicates. I mean, really what we found, the key to retention right now is really making sure people have a good work-life balance, making sure that we're not overworking, overstressing people on a regular basis. I mean, everybody has crunch times, of course, but making sure it's not their reality all the time so they can be the most productive when they are here and really get the most out of their time. One of the other things, because we do have about half of our staff that is in the office a lot, and sitting at a desk looking at a computer, making sure that they have the ergonomic tools that they need to really be comfortable so they're not hurting themselves or ending up with issues over time, because sitting at a desk, keyboard, mouse, screen, all the work day, it can take a toll on you. And so we provide sit-stand desks for our people. We make sure that they have good ergonomic tools. We encourage everybody to take about 5 minutes every hour get away from your workspace. If it's, I've got one person, he gets up once an hour every hour to do a lap around the floor, refills his water bottle. And so I kind of be like, everybody, let's do that. You know, it's a, get up from your station a little bit so you don't kind of fall into this hole of screen time. And then just, it's really important to know that it doesn't matter what size you are, or if it's your first day or you're doing this, you know, 15 years later, like we are, you can do so many little things that don't really cost much more than time. And just because you'll see, you know, all the people that are here today, we've been doing a lot. We all started somewhere, and, you know, start somewhere, pull your people if you can to see what they find most valuable. Since we are such a small organization, we're able to pull our people often and to develop our strategies based on what do they want. Not everybody can do that, but if you're able to, it's good to let people have at least some sort of a voice so that you're getting the most engagement out of them you can.
Awesome. Matt, what are some of the things that you think every organization should be considering right now, given our modern workforce and the trends that you're seeing?
Well, one of the things, you know, and especially being in an organization that is growing at the rate we are, we have a vertical learning curve. So that brings on a lot of stress. We have a very safety conscious workforce, but a very stressed workforce. And one of the things that we do in a lot of our meetings and discussions is to say, take a break. Take a break with your team, go on a walk, get out there and de-stress. There's nothing that we can't do, that we can't accomplish, but when we keep looping it back in our minds and we don't get away from it, then we see our productivity fall, we see our stress levels go up, and then people start to really get disinterested in what they're doing because they're focused more on how to de-stress in the environment. So by encouraging them to get out, go and get a change of scenery, get away from the work for a little bit, and these breaks don't have to be very long. They can be micro breaks, 5-10 minute walks, just around outside to refresh. That's one thing that we do encourage, to kind of let that stress go, get back in with a fresh pair of eyes and continue the work. But in those the three things really to ensure that we're successful is that we have to have a well-defined program. Our program, being from the kind of the grassroots effort, has a very well-defined definition, a set of goals and objectives for certain KPIs that we want to see between, you know, employee incidents and injury rates, but we also want to see that wellness piece as well. So we've really built the program around that total health and safety goal in mind. The other part is leadership. We need our leadership buy-in, a declaration from the leadership to say, yes, we are totally committed to health and safety in the environment, because that's where the message really stems from. It's not just from a bottom up, but it's also from the top down, and we have to have leadership buy-in to be successful. The last thing is visibility. If we're not visible from our safety programs out to the rest of the workforce, or leadership isn't visible with that mantra of safety and health, then it falls by the wayside. It's a secondary thought. So that visibility piece is very important to our success.
Well, that leads very well into this next question around how you all are being role models for total worker health. And you all just touched on very important aspects around the business case for supporting employee health and well-being, retention and recruitment, ensuring good work-life integration. And I know that I even personally struggle in my line of work to practice what we preach. So as the person really in charge of not only designing these types of programs and initiatives, but really implementing them on a daily basis, how do you do it? How do you personally demonstrate your commitment to health and safety in practice? Matt, I'll just come right back to you. How do you model the way?
Well, you have to be able to walk the walk and talk the talk. If you don't, then nobody has credibility, right? So we need to have that credibility, and the way that we gain that is through actively caring. And so when you approach somebody or you see something that may not be right, that could harm somebody, we do little interventions. We come from a place of caring, and we really model that for the rest of the employees. I've been in different environments, as well as I'm sure most of our audience has been, where we get to an explosive place, especially when we're dealing with all the forces that are upon us to be productive. What we do is we come in that active caring role, be a soundboard, calm things down, and really kind of reduce that stress level and clear that path so that people can calm down and start thinking rationally. That happens quite a bit, especially in a very dynamic environment, but you have to be that role model, and you have to model it by actually doing it. So it's a lot of leadership by example.
Katie, how about you?
Again, can you hear me?
Yes. Yep.
Okay. Again, having flexible work schedules for my team and work from home policy, I never want my team to feel stressed out because they have to come and go and leave, or they have to be at an appointment. I think you're going to identify productivity issues if you have them. I trust my team, which also creates good morale for your team if you have a trusting environment. I try to participate in all of our wellness offerings. So that's really important, so that you know what you're, communicating to your employees. I know if there's issues with them. I know if there's something that's not working that can be corrected. Also, I try not to ask employees or promote things that I don't think that I would do myself. We have our first Courage Classic team. We have a big event coming up this weekend. I captained the team. I've never rode 80 miles in the mountains before up over Vail Pass. But I wanted to push people outside their comfort zone, and I didn't feel like I could do that if I wasn't going to do that. So we have a big team this year, and we're excited because there's people who've never ridden a bike before, and they're getting out there. So doing those types of things, and then really just advocating. I'm an advocate always within the hospital, even when it's not always heard, even when it's not popular. That's my job, and I have to be an advocate for health and wellness. And so with internal stakeholders and leadership, whether it's around food or when we're setting, we're launching new buildings, new hospitals, if I'm asking, why are we putting fryers in? Please don't put fryers in. Are we putting in a gym? Have we thought about this? So all of those types of things are important.
Thanks. Christina, how about you? How do you personally demonstrate your commitment to health and safety?
Yeah, well, it's kind of reiterating what they said. You have to walk the talk. If you're not doing it, how would you expect somebody else to do it too? You have to demonstrate commitment and not be flaky on it. You have to, if you're gonna say you're gonna do something, follow through and do it. Not having that follow through just kind of sets the wrong tone. I'm really fortunate here that our leadership is 100% buy-in, and they really get why total worker health is important. And so they participate in most of our activities. I participate in all of our activities. And because we're small and I get to see most people every day, if somebody didn't participate, or I know it's kind of something they really would have enjoyed, I just come, hey, why didn't we see you there? And what would make this so you could do it better next time? Try to work with people's schedules so that we're offering things that occur during the workday or right after work or on a weekend, so that it captures all the different people and their different schedules, so that even though, if we always did something on a Saturday, there'd be a whole group of people that could never come. Or if we always did something after work, there'd always be a whole group of people that could never come. So we try to stagger our offerings and just make sure that they're we're always doing things that people can participate in one way or another. So even though, for a good example, we do an annual 14er every year at our company. Not everybody is capable of climbing a 14er, myself included. So the rest of us, maybe we go up a little way, maybe we do a hike that's nearby, and then we'll all meet for a beer afterwards or something. So just finding ways to include everyone so that there's no excuse for why they don't want to participate.
That's great. Yeah, I think you all just hit on an important point, which is identifying ways that you're expanding your efforts to be the most inclusive it can be. And I know that's an ongoing challenge for a lot of the organizations in our network is working on that engagement piece. And I commend you all for not only being such amazing champions, but for truly walking the talk. Next question is really transitioning to your experience as a certified healthy workplace. All of you have completed the HealthLinks Healthy Workplace Assessment on behalf of your organizations, and this is really meant to serve as an educational tool for benchmarking what you're doing across the best policies and practices, strategies for total worker health. What does it mean to you to be a certified healthy workplace? Christina, how about you?
Oh, we love it. It's nice. It's a nice way for us to demonstrate to our employees our commitment to it, because it's one thing to do the activities, but this is a way that we show that this isn't just a one-time activity. This isn't something that maybe it'll catch on or not. Like, this is something we're committed to doing, and we're going to keep doing it, and it's part of our culture. So it really demonstrates that to our employees, that we're going to take the time to go through a certification process, and we're going to keep recertifying this every year because this is important to us. And not even just to our employees, we actually put our sticker on our front door, so when people ring our doorbell and they have to wait out there, they see it. And so it's been kind of a conversation starter sometimes too, if you've got somebody who's like, hey, what is that? And so, well, let me tell you. So it's been really good to be part of this organization. And it's just you guys are great support.
Katie, how about you? Children's Hospital has been participating with us for a number of years and has received awards at our annual event. What does being a certified healthy workplace mean to Children's?
Well, again, you have the bragging rights, which we also like to do. We can tell our leadership and tell other, we have a really great wellness program, but when you are being recognized, that's really helpful to also demonstrate. We have our stickers up on the wall. We have our awards on the office and on the wall. But really, it's also great to be able to, have an ongoing annual evaluation so that you can see where you are related to best practice and where you could be going. Do you have opportunities? Do we, we've identified in the last couple of years ergonomics and expanding breastfeeding support here at the hospital. And so we've been able to work with some of your folks to try to look at what are some other resources that we can, look into to expand our offerings here for employees. So it's great to be recognized, and it's awesome to have the support to constantly evolve and enhance our program.
Great, thank you. And Matt, I know you and Charlotte's Web are newer to HealthLinks. What does it mean to you? Why did you decide to participate, and how have we helped so far?
Well, when I first got introduced to this program, it was back in January, February, from a safety training that you guys hosted. And I started asking more questions. Well, what is this exactly? How will it help? And then I saw very quickly that it's a great way to benchmark where the program that you want to build can take off to, and it really sets out a great roadmap. we didn't really feel the big impact until we received our Kickstart certification. And I sent that out to the company, and the response was overwhelming in a very positive way. People are very excited about it. They want to be able to achieve more. They want us to get to that leader status, and they want to be able to progress our programs to get to that point. So it is not just a one-person crusade. It really became a whole company crusade, and got the visibility and the traction that I was hoping for to really move the kind of that productivity and morale in a positive direction. So it's been a really big deal for our company. We have printed out our certification. We've hung it where people can see it in all of our locations, and it does start a very good conversation, especially with our stakeholders and our customers that come to visit us. They kind of point to and go, oh, what's that? And we get a conversation piece to explain. So it's been a wonderful experience so far.
That's great. Good to hear. Last question before we open it up for attendees to ask any questions you have. We have our annual HealthLinks event coming up on August 15th called Celebrating Colorado's Healthiest Places to Work, and are thrilled that all of you are going to be able to make it. What are you most looking forward to at this year's event? And I know Katie and Christina, you've both been there, and Matt, we're excited to have you and your team. What are you looking forward to? Katie, why don't we start with you?
Sure. Well, it's always a fabulous event, and it's great to be able to run into all these people that we've worked with over the years, or met, or been able to mentor at previous HealthLinks events. So it's just a great time to connect with people. Sometimes there's really great vendors there that I don't know about, and we've been able to work with some of those. And then really, no matter the size of your organization, obviously ours is huge, but we only have 2 wellness people on our team. So, there's always takeaways from the event and lessons learned. And no matter what the size, we always are able to learn from others. So it's a great networking event.
We're excited to have you there, especially as one of our previous award winners. So, Christina, how about you?
It gives me new ideas to go, just to hear the success stories and what other people are doing. Just kind of usually come away feeling energized and, oh, I heard about this cool new thing and we're going to do that this year. I really liked last year those kind of like mini breakout roundtables that we had, where you got to kind of work in a tiny group and chat with others about a specific topic. And that was really fun, just to kind of have that group discussion. So just talking with the people that are there, because you're all there for the same reason. And it's really just, it's a really good, energizing event, and it's fun.
Great. What you're referring to, we call it our meet your mentor session. And this year we've invited a range of experts, anyone who from one of our internal professors who's going to be speaking on safety, climate, and total worker health leadership, to a lot of our previous awardees from our network that are going to be talking about what they're doing that's industry specific. So that's one of my favorite parts too. And Matt, it's going to be your first time. What are you looking forward to?
I'm looking forward to networking and really gaining a perspective on how others in our industry, are performing their total worker health and safety initiatives. I want to be able to do a little bit of benchmarking and just learn, just kind of soak it in and see what nuggets we can take back and implement back in our program and continue down that path of continuous improvement.
Well, look forward to seeing the 3 of you there. I want to now open it up, and Alexis, I'll have you help field questions, but I believe if you're on the phone or joining by Zoom, you can either chat, put your ask your question in the chat box or Q&A. Alexis, how do we run this again? Remind me.
So I've actually got a question already. So I'm just going to go ahead and read it out. And this question is for Katie O'Connor. And the question is, how does Children's Hospital approach flexible work arrangements for individuals who are in roles or positions that can't be too flexible?
So it is an ongoing challenge. And so, there is built-in flexibility. If you're on a clinical floor, typically you're going to work 12-hour shifts, but you only work 3 days a week. So even then, it's not always seen as equitable if administrative people have the flexibility to work from home, but there's also administrative people that say, hey, I would like to work 3 days a week. So I think in past we've done some pilots on doing 9-month work years for certain roles. They've done some other piloting to look at certain roles in having flexibility in various clinical ways. I'm not as versed in that because I'm more in the admin world. But in the past few years, we've really been trying to educate the leadership around, allowing flexible schedules within your teams, because it really does add to productivity, decreases stress, and it really makes for more satisfied and engaged employees. I hope I answered that.
I think so. Yeah, and that's a very common question. And I think it's a challenge, but something we can still strive to improve. So if others have questions, you can certainly use the Q&A box at the bottom. For some, it might be at the top of your screen, next to your mute bar. But I feel free to also jump in on chat. And if you have any questions that we can help follow up with, our contact information will be sent out after the webinar. And while we're waiting for a few more questions to come in, I wanted to make sure that all of you knew about our annual event. And we've got our events coordinator here to help us. So let's go ahead and just briefly introduce, a few of the highlights that will happen at August 15th. And Courtney Cuff is our events manager who is leading the whole show.
Hi, everyone. As Alexis said, I'm Courtney Cuff, and I work on events and community relations for HealthLinks. And today, first of all, I just want to thank all of you for tuning in. This has been fantastic, and I really appreciate our speakers participating today. I think I got a lot out of this, and I hope everybody else did too. I know we've kind of briefly talked about our annual event. It's taking place on August 15th. It's a full day of programming in Lone Tree, Colorado. There will be 3 educational programs in the morning, followed by an afternoon where we celebrate businesses, nonprofits, and community partners creating healthy and safe workplaces in Colorado. So I urge you all to sign up. You'll each receive an email with the presentation slides for today that contains a link to the registration page. You're also welcome to visit the event website, which is cohealthybiz.squarespace.com. I urge you to visit. If you haven't signed up already, I hope our speakers referencing the event and the great networking and learning opportunities convince you to do so. I hope to see you all there.
Nice. And so we have a couple more questions. And so the first question that came in, this could be for any of our panelists, and it's really more focused on the leadership of an organization. And it's simply, how do you engage your leadership?
I'll go ahead and attempt to answer that. The way that I engaged our leadership about our environmental health safety and total worker safety was really to lay out a roadmap plan about what we wanted to achieve with a safety program. How did that look? What did that roadmap look like? And then walk them through some metrics. We have our total recordable injury rates, our DART rates, but then also looking at how do we impact the lives as a health company to our employees for employee retention, etc. So having a good plan that shows the metrics, that shows the impacts of that service that you're providing is really a way that helped me get to where we are today in a very short period of time with the buy-off from our leadership. If we were to go to our leadership without a plan or a roadmap, then we'd probably be sent back to say, what are we looking at, Matt? What are the dynamics? What are the services? We have to have that in our mind up front as we approach that leadership for the buy-off.
I would just add to that too, that since we are a small organization and finance and the general operation of the company also falls under my umbrella, every time I propose a new initiative, I'm also prepared with what is the bottom line cost, does it fit into our budget, and how will this impact our employees' utilization, because at the end of the day, we still have to run a business so that our employees can have a great job at a great company that cares about their health and wellness. So it's important to show them how do we do this without hurting ourselves. And so that's a piece to always keep in mind when you're proposing a new initiative.
Similarly, we have to do the same. We have to make program recommendations annually to our leadership and get, utilizing our claims data for the previous year. We have to inform our programming and then, make the case to executives about which ones we want to adopt for the next year. But also we do things like we put wellness walks on their calendars, and we do night shift rounding here because our night shift, obviously we have a lot of people who work at night, and during those hours, the wellness office isn't open. So we actually recruit executives to stay and do the night shift with us. We have them engage in different initiatives that we're doing. So we get sneaky if we have to sometimes, and we buddy with the executive assistants and we put events on their calendars, and typically they really like that. They like to get out of their day-to-day and break and go for a walk with employees, and so typically they're really happy to do those types of things.
Great. Thank you all. Yeah, those were really good answers. We have another question that came in for Matt. And the question is, as an established safety professional, do you feel like others in the safety industry are embracing total worker health? If so, how and why?
That's an excellent question, because without going to the seminar that you guys put on, I wouldn't have stumbled onto what total worker health is. And I'm really pleased that I did, and I think it's going to take off within the safety profession. Why? Because we get into this profession because we care about people. This program is designed around caring about the individual, your individual employee. And it goes from the very top all the way down to the front line. So it encompasses everyone. It's a great way for folks in our profession to really promote what we got in business for. And that's for health and safety, helping employees and caring about them, and caring about how they get to and from work in that one perfect condition that they came in to begin with.
Great response. And that has not just in context, that question's been being asked a lot. It's been talked about over really the last decade about how the integration of safety and health promotion works best. And I think all of you and the examples that you gave in the last hour reflect a lot of the opportunity to be thinking about the connection between health and safety. So as a safety professional, it's really neat to hear your perspective on the emerging field of total worker health. We have a couple more minutes for questions, so please go ahead and raise your hand or type in the Q&A box. And I think we have, and just as a reminder, over in the chat bar, Alexis has posted 2 links. One is to the WELL certification that Christina mentioned, that Ambient Energy is working on. And then the other is for our link to the annual event and the pre-event workshops that are going to be held. Well, in closing, I want to say thank you to Katie and Christina and Matt. And I want to also recognize all of your efforts and your accomplishments in this space and your commitment to workplace health and safety. I want to encourage all of our attendees here today. Thank you for your time, and also encourage you to visit the webinars that we have recorded on our YouTube channel. So you'll receive a link. Please give us feedback. We're always looking for feedback on the types of topics you're most interested in. We're going to be working on revamping our webinar series and relaunching it this fall to really look at providing content around the needs and the interests of all of you. So we want to hear from you. Now's the time. And visit us at healthlinkscertified.org, where you can find what we talked a lot about here today, including our healthy workplace assessment. Some of what Katie was talking about regarding family-friendly workplaces is an initiative that we have through our family-friendly module. And that's an extension of taking a deeper dive into looking at how you can really implement the policies and practices that can help support caregivers of all types in your workplaces. And then Alexis, who heads up our continuing education program, is also the expert and the one that leads all of our education efforts, including our online portfolio of courses. So if you're interested in receiving more education on a lot of different topics, including in the cannabis industry, health and safety in the cannabis industry, we have a new course in suicide prevention. Make sure to visit us and where you can learn more about those courses. So thank you again to our panelists and to our attendees, and I look forward to seeing you next month at the event. Take care, everyone.